Hello, and welcome to episode 35 of Stuttering, Demystified, and Beyond. It is hard to believe that we are already up to episode 35. This is your host, Lori Melnitsky, speech language pathologist, stuttering specialist, and ADHD life coach. I stuttered very severely and have dedicated my life to helping people who stutter and helping people communicate and achieve their goals. In this episode, I talk about a very important topic, probably one of the hardest that I have to really explain when I speak to parents, and one of the hardest that I had to accept myself, which I'm not sure I still have accepted it. Is there a cure for stuttering or stammering? Stammering is also is used a lot in other countries such as England and even Australia. So is there a cure for stuttering or stammering? It's like the $1,000,000 question, especially when kids get past about age 7. Will they stop stuttering? And especially when parents start pointing out to their kids that they are stuttering or speech pathologists. And we have to be very careful, because when we point it out a lot, we're telling them you're doing something wrong, because stuttering is a disruption in the normal flow of speech. Under the age of 5 or 6, sometimes kids do stutter developmentally. That's really a developmental disfluency. Those kids are a little bit different than someone who's actually stuttering, who maybe has a history in the family, who's been stuttering for a few years, who starts to feel the negative impact that stuttering can often bring. So it's very important to get these kids help early, because although there's no cure, there are definitely ways that many people who stutter can manage their stuttering and encourage them to speak so they don't feel the negative impacts of stuttering and they don't feel shame and embarrassment. And so parents can understand that the goals of therapy are to improve fluency and improve confidence. And how much fluency one can derive from therapy is really person independent. Sometimes there are kids who I've seen who really, with long-term therapy and really working hard on it, can achieve a high degree of fluency. There are others who find it very challenging, and it's in no fault of their own or their parents, but they feel stuck. So we really have to bring these kids to people who specialize in stuttering. We don't know exactly what causes stuttering. We do know some environmental outside factors can make it worse. And I can tell you definitely the months of August bring high stuttering. It isn't so much that people are so anxious, but they might be anxious about school. They might be thinking about meeting new people. It's not a psychological issue. It just is what it is. I recall a few years ago someone coming to me who I would never know that he stutters, and he was really expressing the fact that when he goes to school in new situations, it really brings his stuttering on and he starts hiding. And in that case, we worked a lot on the emotions related to stuttering. So again, it's a very tricky question when parents ask, because it's hard for them to accept it. It's hard for us as speech pathologists, because many times we are trying to help people, so we fix the problem, and we can't always fix it. I wish we could, but we can't always. But I can tell you, someone who was very disfluent like me and who stuttered a lot, there are definitely ways of helping. It's very important for family members to understand, to offer non-judgment when speaking, to not point out, oh, by the way, you stuttered more. Sometimes to not ask so many questions because it starts to create so much stress. And to really just be supportive and encouraging. All these things will really help the person who stutters. So again, is there a reason to get speech therapy? Absolutely. Absolutely. Sometimes if you wait, you put these kids in a position of hiding. And we don't want them hiding. We don't want them running out of a classroom because they're afraid to say their name. We don't want that. Absolutely not. We don't want them picking a field like I did, like accounting, that they don't like because they're afraid of speaking. So again, there is no magic cure. Definitely as they start to get toward the teenage years, I definitely push for more intensive therapy. So I hope this episode helps. If you're a parent and you're frustrated seeing your kids struggle, I certainly understand it. It's nothing that you've done wrong. But there's nothing wrong with getting help and figuring out ways how to help them and be in situations that encourage a more relaxed speaking environment, learning some speech strategies. See, that was hard for me. Learning some speech strategies and learning ways how to feel more comfortable speaking. Remember, a lot of people are not comfortable public speaking at all. So don't expect some of your kids to all of a sudden be great public speakers, to want to present in front of the class. They don't even learn public speaking and they're expected to present, and that's wrong. Not everyone has to do a great presentation in front of a class. It should be their option. So I hope this information helps. Again, I'm going to end this episode with always believe in yourself. Always live life to the fullest. Overcome fears. If you want to reach me, you can reach me at Lori, Lori, at allislandspeech.com. If you are an adult who stutters, we offer individual and group therapy. And we do offer one-to-one therapy for all ages, as well as ADHD life coaching for college students and adults. I hope this helps you. And have a nice day.